Hey everybody, Chris at Peterson Physical Therapy. Today I'm going to show you supine diaphragmatic breathing. It's a great exercise, especially for starting out if you're experiencing back pain. It can help with just getting the right muscles working, the core muscles working. Basically, think about it as if it's the fundamentals. Like anything you practice, you always have to work on the fundamentals. Well, we have breathing is very important. We all do it, but not all of us do it correctly or efficiently, and that is really truly the fundamentals there. Getting that down really helps to get the core activated correctly. So you're going to start out in this position where you're on your back with a pillow under your head. Your legs are going to be propped up on something so that your knees are basically vertical from your hips. So I would even want him maybe slide down just a little bit more there. There we go. So the hips are almost directly under the knees there. So we're using a chair. You can use couch at home, chair. I've even had people, if they can't get down on the floor, use like a cooler or like a plastic storage container upside down, where they can do it on their bed, and I'm not going to put a hole in their bed. So once you're in this position, again, basically at 90 degrees at the hip, 90 degrees at the knee. The knees are about shoulder width apart. The feet are a little bit closer together, but they don't have to be touching. And again, the head's just comfortable here. Now, what we're going to do is have him breathe in through his nose as if he was smelling flowers, and try to breathe into his abdomen. And then he's going to exhale, blow out through the mouth, nice and slow, long breath as if he was blowing through a straw. And primarily what we should see is most of the movement occurring here in his abdomen. We shouldn't really see any movement here in his chest. So when you're doing this at home, you can basically take a hand on your abdomen, the other hand on your chest, and try it that way, breathing in and breathing out. And again, the hand over the abdomen should be the hand that's kind of moving. One thing that we like to use in the clinic, instead of the hands, if you go ahead and put those down, is people get a lot of feedback from using like an ankle or a cuff weight. So this is a 5-pound weight. Just place it over the abdomen there, and it helps to kind of give you that feedback of where your breath is going. So on the inhale again, his abdomen should kind of be pushing up. We're filling up with air. On the exhale, the abdomen should be moving down, and there shouldn't be much movement here in the chest. Once you have that down, this can be pretty challenging to do. Once you have this down, it's important to think about, you don't want just the belly to expand, rise, and fall, but you want expansion like 360 degrees around the waistline here. So usually what I suggest is for my patients to try to think of their lower ribs kind of expanding up and out, almost like an umbrella opening up, and then closing down as if the umbrella is closing on the exhale. So again, on the inhale, kind of breathe and try to push those ribs up and out. And you still get some expansion of that abdomen forward, but also gets a little bit to the side and even some to the back. And then on the exhale, those ribs should kind of collapse down and in, almost like the umbrella folding up.